So now the diagnosis for Lynch syndrome is based genetically. So for those with a proven genetic mutation in the mismatch repair system, but also we know that genetic testing is not perfect. So for those where there's no gene positivity, but where there's evidence of microsatellite instability and confirmatory immunohistochemistry. So what is the colorectal cancer risk? It's reported quite variably. Most people will say probably around 60% lifetime risk. Some authors would say up to 80%. The mean age, again, reported variably, but is probably 40 to 50 years of age. And there's quite clear evidence that there's an accelerated adenocarcinoma pathway. We know that the cancers are predominantly right-sided, and there's very typical histological appearances, such as the mucinous appearances, tumour-infiltrating lymphocytes, and Crohn's-like reaction. So what's the role of colonoscopy? Well, clearly here it's cancer prevention. We want to find the pre-malignant adenomas, resect and prevent cancer. There's wide guidelines from every single group that you can think of, and lots of consensus experts all really agree that it should be 1 to 2 yearly colonoscopy from the age of 25, or 10 years younger than the earliest affected relative. None of the guidelines actually recommend chromoendoscopy or NBI, which I don't really understand. My personal opinion is that all of these patients should have chromoendoscopy for surveillance. There's data from a number of studies that I've listed there, from France, from the UK, and from Boston, and one from the UK regarding NBI. All of these have shown that the polyp detection rate is doubled, if not tripled. So quite why it's not uniform in all the guidelines, I'm not really sure. So whether chromoendoscopy, NBI are beneficial purely because it's that, or whether in actual it's a longer procedure is always a long argument. And interestingly, the group from Boston showed that if you did a 20-minute withdrawal time, the adenoma detection rate was exactly the same as the chromoendoscopy. So I think the take-home message from that should be allow plenty of time. Probably, I would say there should be 4 of these with dye spray on a list, and if you're going to do the job properly, that's probably more than sufficient work. So is there outcome data to show that it works? Absolutely. So we've got a really quite old series now from the Finnish group that showed that it reduced colorectal cancer by 63%, and indeed halved the mortality. That wasn't statistically significant, but the p-value was 0.06. So it was just right on the border of significance, but I think definitely a valid outcome. And then more recently, Hans Varsen's group have published a very large series in 745 patients, and this really has been the